South of Dakar, Montpellier, IRD, and so on. So we were able, using this lab, when we installed this lab in the country, first to train the local people, and then also to confirm the ninth Ebola outbreak. So quickly we are able to show that we could use the vaccine that was put in place in West Africa to quickly vaccinate people in the country and to control the outbreak. And also, we use the same capacity using the local staff to confirm within 6 days after receiving the sample in the lab to confirm the 10th Ebola outbreak in the country, and to quickly, within 1 or 2 days, to deploy a team in the field and to start the response activities. So I think it's a capacity that we deploy in the country, and it was possible using this capacity to respond very quickly. And also using the same capacity during this recent outbreak, we were able to follow in the same time the Ebola outbreak, the COVID-19, the new Ebola outbreak, to confirm that there is a 11th Ebola outbreak that was different than the previous one, and to show that also there were 2 strains that were circulated during this outbreak. And I think this is a kind of an experience that we built these 2 years of work. And this was possible, as I say, using the collaboration that we have in the country and in the continent with the Institut Pasteur de Dakar, and also with the logistic support of Africa CDC and so on. And so the pathogen genomic, as Dr. Lin said, Dr. Maurice said, we would like that this new technology become a routine. This is why I really appreciate the initiative of the Africa CDC to launch this pathogen genomic initiative. And I think this is something that we really need in the continent, since now, for example, using the lab, we are able to sequence almost 114 confirmed cases of Ebola over the 119 cases that were confirmed during this new outbreak. So it's almost over 90% of the sequence right now. We almost bring this number from the 5% in West Africa to 15% during the previous outbreak, and to 90% right now. So I think that is something that we need to improve. And the big challenge that we are facing in the continent, I think, is the bioinformatics and also the logistic for reagent and so on. As I can say, most of the technical support that we get in the country come from outside the continent. It's not normal. So I think we need to build this network and see how we can get this technical support, the training, and improve our capacity using the experience that we have in the continent. And for the experience that we build, the place where we see that pathogen genomic is very important is what we are facing right now. Since the previous outbreak, we were able to improve the surveillance activity, because using the surveillance, the field surveillance, we were only able to trace less than 40% of the contact of the confirmed cases. So using the pathogen genomics, we are able to link some of the unknown link confirmed cases with their source of contamination. And also because of the political issue, because of the unrest situation in the region, we are not able to conduct effectively the field surveillance. So we use the pathogen genomics to compensate the gap that we have in the field surveillance. And this is what we are doing also right now, using the pathogen genomics to also try to link the confirmed cases in the contact and also to identify the source of contamination. Right now, we are facing a different outbreak where most cases are isolated in the area. The logistics is very difficult, and also it's in a very remote area. So I think this is what I would like to share with you.
Thank you very much, Dr. Placide Mlamba. So we are 3 minutes over as far as the speakers are concerned, and severely over by time on the rest of it. So unfortunately, I have to kind of say with regrets that we won't have time for answering any of the questions. They have been aggregated, and maybe potentially you can reach out to your speaker in particular if you have any interest. With the numbers that I see in the participant layer, I see tremendous amount of interest still going forward. So I appreciate everybody's attention. I won't go into the daunting task of actually trying to summarize any of the stuff that's been said, just to say that it's been tremendously enlightening and educational for all of us. And on behalf of all the participants, all of the attendants in the audience, I'd like to make sure that I extend my gratitude to all our speakers and looking forward to our next conversation or working together in the future. Let me pass it back to you, Wynne, if that's okay with you, and I'll hand over.
Thank you.
Thank you.
Thank you very much, Solomon. Excellent panel discussion. A lot of insights shared as well as experiences from across the continent and elsewhere. Thank you very much for that, and thank you to the panelists. Now we will move on to our second panel discussion, where Dr. Ahmed Okwell will moderate. And Dr. Okwell is the Deputy Director of the Africa Centers for Disease Control and Prevention. Dr. Okwell, I hand over to you.
Thank you very much, Wayne, and good evening, good morning, good afternoon, wherever it is that you may be. And I'm welcoming you to this next session, which will shift a little bit from the conversation we've been having on the actual need for pathogen genomics in public health on the continent, to talk a little bit about funding and sustainability for this initiative and this area of work. Just a quick reminder that please mute your mic if you're not speaking. And secondly, questions and comments, let's have those in the chat box. And when you provide those questions and comments, please indicate who you are in terms of name and the institution for which you work. Now, in the interest of time, I will forego a lot of the introductory comments that I had. We've had a very good conversation in the first panel. And the second panel, again, we have a very eminent group of colleagues. First to come up will be David Blazes, who is in surveillance and epidemiology at the Bill and Melinda Gates Foundation. He'll be followed by Phil Fabo, Chief Medical Officer at Illumina. And third will be Greg Armstrong, the Director for Advanced Molecular Detection at CDC in the US. Next will be Gordon Sangera, the CEO of Oxford Nanopore Technologies. And finally, we'll have Mark Ihimoye,